Have you ever had a stomach ache that just wouldn't go away? Maybe a little bloating here, some back pain there, and you chalked it up to just something I ate? Bloating, indigestion, back pain. Many older adults assume these are just normal signs of aging or minor digestive problems. But in some cases, they're the earliest red flags of one of the deadliest cancers, pancreatic cancer. According to the American Cancer Society, pancreatic cancer has one of the lowest 5-year survival rates, in part because it's so difficult to detect early because the early symptoms are often confused with common stomach issues. But here's the good news. Awareness can make all the difference. Today on Golden Aging Health, we're uncovering a serious and often misunderstood disease, pancreatic cancer. And more importantly, we're going to break down 5 early signs that many seniors mistake for harmless stomach problems. Why should you keep watching? Because catching pancreatic cancer early could save your life or the life of someone you love. Let's get started, and if you haven't already, please subscribe to my channel. I bring you practical, doctor-backed advice to help you stay informed, independent, and in control of your health. Let's start with the first signs you might confuse with stomach disease. Sign number 1. Persistent morning nausea. It's not just a sensitive stomach. Have you noticed your mornings starting off with a queasy stomach lately? Maybe a sour feeling that creeps in before you've even had your first sip of water or tea. It's easy to brush it off. Maybe I didn't sleep well. Maybe it's my medication. Or maybe it's just age catching up. But here's something many seniors don't hear often enough. Persistent morning nausea could be your body's early warning sign that something more serious is happening, especially in your pancreas. The Cleveland Clinic notes that persistent nausea is one of the common early symptoms of pancreatic cancer, especially when it appears alongside loss of appetite, bloating, or fatigue. This isn't just the occasional upset stomach. It often shows up first thing in the morning, doesn't go away after eating or resting, and gradually becomes part of your daily routine. That's exactly why so many people overlook it until more serious symptoms appear. And this is exactly what happened to Mr. Fawn, a 70-year-old retired engineer from California. He started noticing mild nausea every morning that slowly became more frequent. At first, he assumed it was due to late dinners or mild reflux. But when antacids didn't help and his appetite dropped, he went to see his doctor. After an ultrasound and a few blood tests, he was diagnosed with early-stage pancreatic cancer, caught just in time before it had spread. His doctors believe that paying attention to that early nausea may have saved his life. So if you've been waking up with nausea for more than a week or two, and it keeps showing up, don't ignore it. Write down how often it happens, and take that note with you to your next doctor's appointment. Do you ever wake up feeling slightly nauseous or with an unsettled stomach? Type nausea below to share your experience. It might help someone else recognize the signs. In a moment, we'll look at another common morning symptom that many people chalk up to dry air or allergies, but it could be something much more serious. Sign number 2. Stomach pain that moves to the back. Ever feel a dull, nagging pain in your upper belly that seems to reach around to your back? It's easy to blame it on a pulled muscle, sleeping wrong, or maybe just gas. But when that discomfort becomes a daily visitor, especially in the same spot, it could be something far more serious. Why does this happen? The pancreas sits deep in your abdomen, right behind the stomach and close to the spine. When a tumor begins to grow, it can press on nearby nerves or digestive structures, causing pain that feels like it's coming from your back. It all started with George, 75, a retired mechanic from Ohio. He started waking up with a dull ache in his upper belly, sometimes feeling it wrap around to his back. He figured it was from leaning over his workbench or old age catching up. But when it began waking him up before sunrise and pain meds stopped helping, he went to see his doctor. An abdominal scan revealed a tumor on the tail of his pancreas, quietly growing for months. If you're feeling a deep, persistent pain in your upper abdomen or back, especially one that doesn't seem tied to movement or muscle strain, don't ignore it. Ask your doctor about imaging tests like an abdominal ultrasound or CT scan. It could help catch something that's easy to miss in the early stages. Next, we'll look at a symptom many seniors find embarrassing to talk about, but it can be one of the earliest red flags that your pancreas is struggling. Sign number 3. Pale, greasy, or floating stools. Let's talk about something many people don't like to bring up: your bowel movements. It might feel a little uncomfortable, but the truth is, your stool can tell you a lot about what's going on inside your body. One of the earliest warning signs of pancreatic cancer is a noticeable change in the look, smell, or texture of your stool. Specifically, we're talking about stools that are pale, greasy, or float in the toilet bowl. A study published in the journal Pancreas found that over 1 in 5 people with early-stage pancreatic cancer had noticed their stool looked different for weeks, even months, before diagnosis. Most of them didn't think much of it at the time. They just assumed it was something they ate or a normal part of aging. That was the case for Lillian, 72, a retired nurse from Arizona. She noticed her stools had become light-colored and hard to clean. She also felt more bloated than usual after meals. At first, she thought it might be lactose intolerance or a gallbladder issue, but when the problem didn't go away after changing her diet, she saw her doctor. Tests later confirmed that her pancreas wasn't producing enough enzymes due to a small tumor in its head region. If you notice changes in your stool that persist for more than a few days, especially if they're pale, greasy, or unusually smelly, don't ignore it. Bring it up with your doctor. It might feel awkward, but it could be a critical clue to something your body is trying to tell you early. If you found this video helpful, tap the like button and subscribe for more life-saving health insights. And don't keep this information to yourself. Share it with friends and family. One simple click could make all the difference in someone's life. Coming up next, a surprising early warning sign that shows up not in your digestion, but in your blood sugar levels. Sign number 4. Sudden onset of type 2 diabetes, especially with weight loss. Isn't it strange when someone over 60 suddenly develops diabetes, even though their diet is healthy and they've actually lost weight instead of gaining it? This kind of unexpected diagnosis could be more than just a blood sugar issue. It might be your pancreas signaling a deeper problem. Researchers at the Mayo Clinic found that adults over 50 who suddenly develop type 2 diabetes, especially with no family history, have a higher risk of pancreatic cancer. In fact, about 1 in 100 people in that group were diagnosed with pancreatic cancer within just 3 years. The study also showed that when diabetes appears alongside weight loss or changes in appetite, it could be one of the earliest warning signs of something more serious going on in the pancreas. Let me tell you about Edward, a 71-year-old retired postal worker. He started feeling a bit more tired than usual and noticed he was losing weight without trying. At a regular checkup, his blood sugar came back high even though his diet hadn't changed. His doctor thought it was type 2 diabetes, but when his appetite dropped and nausea started creeping in, more tests were done. That's when they found a tumor on his pancreas, quietly affecting his blood sugar all along. If this sounds familiar, or if you know someone recently diagnosed with diabetes that doesn't quite make sense, ask their doctor about screening for pancreatic health. It might feel like an extra step, but it could lead to early detection when treatment is still possible. Finally, we'll cover one of the most visible but easily misunderstood signs that your pancreas might be in trouble. Sign number 5. Jaundice, yellowing of the skin or eyes. Ever looked in the mirror and noticed your skin or the whites of your eyes looked a little yellow? Many people notice this change and think it's just poor sleep or odd lighting. But when that yellow tint sticks around, it could be your body trying to get your attention. One study published in BMJ Open Gastroenterology found that jaundice is often the first noticeable symptom in people diagnosed with pancreatic cancer, especially when the tumor blocks the bile duct. By the time this symptom appears, the cancer may already be in a more advanced stage, highlighting how easily the disease can go unnoticed until it's harder to treat. Maria, 69, first noticed her eyes looked oddly yellow in the morning light. A few days later, her skin tone changed, and she felt itchy all over. Thinking it was just dry skin, or maybe something she ate, she didn't think much of it. But when her urine turned dark and her energy dropped, Her daughter took her to the doctor. Tests revealed a tumor pressing on her bile duct, the cause of all those quiet symptoms. If your skin or eyes ever start to take on a yellow hue, even slightly, it's worth checking out. It might not be serious, but if it is, early action can make all the difference. Are you experiencing any of these signs? Drop your experience in the comments below. Your story could help someone else recognize the signs before it's too late. Let's take a quick moment to review the 5 early signs of pancreatic cancer that older adults should never ignore. Persistent morning nausea, stomach pain that radiates to the back, pale or greasy stools, sudden onset diabetes with weight loss, and yellowing of the skin or eyes. These symptoms often look like common digestive issues, but they could be your body's way of signaling something far more serious. Early detection matters. While pancreatic cancer is often diagnosed late, recognizing these signs early can give you a better chance at timely treatment and a stronger outcome. Recent medical studies show that catching pancreatic cancer in its early stages can significantly improve survival, especially in adults over 60. If you or someone you love is experiencing any of these symptoms, don't wait. Talk to your doctor. Ask for a full evaluation and trust your instincts. You know your body best. If this video helped you, give it a like and hit the subscribe button for more trusted health information. And please, share this with friends or family. One small action could help someone catch a serious condition before it's too late. You can also check out my other videos for more senior-focused tips on preventing major health issues and staying strong as you age.